First of all, see, diabetes is a condition where your immunity is not great, it is lowered. This happens in many diseases. Diabetes is not the only one. If you have a malignancy and if you are on, say, chemotherapy, your immunity is lowered, because what happens is, in the process of fighting the cells of the body, the chemotherapy lowers your immunity. Also, your other cells also get damaged. In the case of diabetes, not a direct damage, but all types of immunity, acquired immunity and the innate or the inborn immunity, the cell mediated immunity, there are different types of immunity. Almost all of them are affected by diabetes. So if you have uncontrolled diabetes, I think that's the byline, or that's the overarching term that we should use. Uncontrolled diabetes leads to a severe decrease in the immunity, and therefore all infections are more common in diabetes, right from a boil or a furuncle or a stye or urinary infection, TB, to you name it. Most of the infections in the body are much more in diabetic patients and much more severe in diabetic patients. There are many other viral illnesses that are also more. For example, herpes zoster, herpes simplex. Many other viral infections are much more common in people with diabetes and more severe. A simple herpes zoster infection of the face or something can take much longer to heal in people with diabetes, and can be more infectious in people with diabetes. So, from the first reports which came from Wuhan, somewhere in December of 2019 and January of 2020, it became clear when they looked at those who had serious infections requiring admissions, ICU admissions, ventilator support, and deaths. People with diabetes were 3 times more likely to have all of these compared to people without diabetes. You have age matched. If you match the age of a, say, 50-year-old diabetic person, 50-year-old non-diabetic person, the deaths and the outcomes were worse, almost 3 times higher. In fact, the initial fatality rates were 2 to 2.5% in the normal population, in the whole population in Wuhan. Of all those who got COVID, it was 7.5 in those percent of those who had diabetes. But remember that also these people, when they had COVID-19, mostly they have type 2 diabetes. And type 2 diabetes is a disease of old age, older age. So it's usually above 50, 60, 70 that you get type 2 diabetes. So it's not just diabetes alone, they're also older people. So you've got age and diabetes now. Remember, a lot of them can have heart disease, a lot of them can have hypertension, a lot of them can be on various medications. So number of factors contribute to diabetic people not doing as well. So that's the, so but I call it as a bi-directional relationship. So if COVID attacks a person with diabetes, then that COVID gets worse because the diabetic milieu, or the body of the diabetic patient, is weaker, and therefore the virus can take over and do more harm. But also, COVID-19 can produce diabetes. Now, how does, in a person who doesn't have diabetes at all, COVID-19 produce diabetes? In 3 or 4 ways. In the first phase, we had it. Now, it's not so much now in the second phase, although the number of cases are more. When the first phase came, go back 1 year of our life, let's say in March or April, everybody was scared, scared. Oh, I'm going to die, I'm going to die, I'm going to die. I remember many diabetic patients called me and said, shall I write my will? Am I going to die? That was a kind of scare. So that fear, anxiety, depression, and stress are all well-known diabetogenic factors. So that is number one reason why COVID producing diabetes, indirectly because of all these stress and depression and anxiety and so on. Number two, due to the COVID itself, people are staying indoors. So what happened? Not so much now, but those days people did stay indoors. So what happened? They start gorging, on whatever they can. It's a kind of release phenomenon. They start overeating, this, that. They're blaming everything. I can't get vegetables. I can't go to grocery. I can't go to this. So they start eating all kinds of foods, fast foods, this, that. After some time, that became not available, but luckily for us. But at that time, there was a binge eating. More than that, they couldn't do their exercise, and therefore physical activity went down, the weights went up. There's clear evidence that obesity levels increased during the period. Obesity is one of the most important causes of diabetes. So COVID, again, indirectly producing this. Number three, when you're admitted with COVID in the hospital, one of the standard treatments for those who are little seriously ill with COVID is steroids. So when you give steroids, steroid-induced diabetes is a very well-known phenomenon. It's one of the commonest drugs to produce diabetes. In fact, almost everybody's sugar will go up. If you and I got it, even assuming you don't have diabetes, your sugar will definitely go up with steroid, because steroid is an anti-insulin hormone. So if you inject it, the insulin won't work temporarily, and therefore your sugar levels will go up. For those who have pre-diabetes, that is enough to trigger diabetes. If you have diabetes, even well controlled, it will become uncontrolled after this. And those who don't have anything may become pre-diabetic or diabetic just because of this. It may be a temporary thing. If you stop the steroids, it may go away. In some, it doesn't go away, because once it triggers, it will stay. It is in waiting for an opportunity to come, and then the steroids come. That's the third mechanism. The fourth mechanism is direct injury to the beta cells. Now, this is being researched a lot, and I am also part of that research. We have not been able to directly prove it, but we cannot disprove it also, that the virus gets into the pancreas and then goes and damages the beta cells and then produces permanent insulin dependent kind of diabetes. Do you have proof for it? Recently, we got some proof. When I say we, it's not me. There's a paper published in Nature Metabolism, a very top ranking journal, where they looked at 4 people who passed away with COVID and diabetes, and opened up the pancreas. They did not know that they had diabetes earlier. Then after COVID, they developed diabetes. When they died, they did a postmortem. And right inside the pancreas, where the beta cells are there, they found these COVID virus particles inside. They also found that the beta cells are all been destroyed. And then they gave some drugs as experimental. From based on that, they took beta cells and then injected virus into it, and immediately they destroyed all the cells. And then they took some medicines which are used for treatment of COVID and injected it along with that, and they found not so much of destruction to the beta cells. And so it is fairly clear that there must be a small subset of people who are developing diabetes due to COVID-19 itself.